Hello there, John Miller, osteopath here again. With a couple of exercises I like to use for nerve root irritation in the lower back, also commonly known as sciatica. What tends to happen is that the discs in the lumbar spine can tear and prolapse, and the centre of the disc comes out and it presses on a nerve, which then causes pain which goes down your leg. What I would often do is use a technique called formanial gapping, where we lay you on your side and try to pull the vertebrae apart to create a bit of space. If you can't do that, one thing you can try is using a foam roller under your thoracic spine here, so under your thorax here, to arch your back open. If you don't have a foam roller, you can use pillows. So I've got two here. One here like so, and another one here like so. Sometimes it helps if you roll them up a little bit to create a bit of thickness, and place it under your rib cage like this, okay? And then let your body hang off the edge, so we're pushing the ribcage up in this direction. Now bring your arm above your head to stretch out this area here, and then bring this leg and straighten it down to this. The weight of the leg is pulling your pelvis down that way, which creates a bit of traction on this side, and the weight of this arm plus the pillows here opens this up, creating a bit of space here. And you want to try this and just lay there for about 30 seconds to a minute, breathing slowly and deeply. Hold your tummy in as you do this to create a bit of tension in your abdominal muscles. Normally people with back problems have weakness in the stomach muscles as well, so if you just help to tone those by holding them in, that will help. What you can do is you can do this rhythmically as well. You can bring the arm back and then bring it back to where you were again. Stretch out the leg as well and bring it back again, and then back forward again. So what's happening here is that this is rocking back and forward in a very slow pumping action. You could do this, say, 10 to 20 times with the arm back and forth, as long as you can feel a bit of a stretch, but not too much. You don't want to overdo this. It can irritate it. So if it makes it worse, you need to stop and do something else, or adjust what you're doing and do it with less power. Then I tend to work a little bit further down. I go into the gluteal muscles, so that's your buttock muscles. So lay down like so, bring the leg across the body like this. So bring one leg across the other leg, place both hands on the back of the knee, straight, and pull towards you. Create a bit of tension through the buttock muscle here, and hold that for up to 30 seconds. What I like to do is increase the tension every 10 seconds or so. So I pull a little bit harder, and then I let my body acclimatise to the stretch, and I pull it again. What you may want to do with this is also pull the shoulders back and down, okay, not just up to your shoulders, pull them down and back to take the pressure away from the neck. And put it one more time, a little bit tighter, and release. And obviously do both sides as well. And finally, of course, you then want to work a little bit further down. Now with sciatica, often the pain originating from the back goes not just into the buttocks, but into the hamstring, and even into the calf and to the foot. So you want to try to stretch out the full length of this. So very simply, using a band or with something else to help you, place the band around the foot like so. I like to bring my leg down as I can. This is a weight to hold my pelvis in position so I don't twist. Stretch the leg out, pull up towards myself like this. And then the really important thing to do now is to look at the toes. Try and pull the toes down and straighten the leg as you do this, and you get a really good stretch at the back of the leg. That should go all the way up into the calf. It may help to put the band over the toes, like that makes it even stronger and particularly painful and uncomfortable. But that's what you want to do, because as you're stretching this here, you're lengthening the sciatic nerve, and where it goes into your spine here, it's basically creating more space. So essentially, it's a bit like this band here. If you watch the band, as I pull it, it becomes narrower. And the nerve is like this band. So it sits inside a hole on the side of the vertebrae, and very often gets blocked up because there's a prolapse or a bulge pressing on here. It stops the flow of blood coming out because the venous system and also the lymphatic system are low pressure. Blood can get in okay, but it's the coming out that's the problem. Then so it gets congested, that nerve gets pressed on, it gives you a lot of pain and discomfort. So when we start pulling all the tissues in that space, like the nerve, pull the nerve a little bit like that, it creates more space, so the lymphatics and the venous system can drain out all the junk that's in there, and just make it feel a lot more comfortable again. So this is a good thing to do usually first thing in the morning, because you'll be stiff when you get up, or even in the middle of the night. Just lay on your side, just stretch the back out, stretch the leg out, stretch the hips as well, and you should feel some relief from what we do. Obviously, I'm not guaranteeing you're going to suddenly feel better. Some people do. It may take a few days. It normally takes at least 48 hours of regular stretching like this. And I usually recommend, if you can, every hour or so, try and do these stretches just to assist your body, because it is a case of you drawing the fluid out of the back, the inflammation out. You've got to get rid of that. But so keep doing that, and I think generally most disc problems tend to be over their worst within the first 10 days, and hopefully if you do this every day, you shorten that period. As I said, I don't anticipate to see much change for about 48 hours, but normally with my clients, when I treat them, after 48 hours, they feel a lot better. Anyway, give that a try, see how you go, leave some comments, and like this video, please. And hopefully it'll help you. See you soon. Bye-bye.